So the first thing we've got to realize is when you talk about heart failure, it's a constellation of symptoms and signs. It's not a diagnosis in itself. In other words, it's not complete. So there are many associated conditions, and they're conditions that cause heart failure. So the most common ones are high blood pressure. If your pressure is very high, then the heart has to work harder, and eventually the heart can't keep up, and that's the beginnings of heart failure. The next one is coronary artery disease. The heart has blood vessels that supply the heart called the coronaries. If they are blocked and there's not enough oxygen getting to heart muscle, it's not going to function properly. If it blocks completely a coronary artery, we call that a heart attack. When you have a heart attack, the muscle can die, and it could be a significant part of the heart muscle. So you get a scar, the pump is damaged, as it were. So that is something we always look for, a previous heart attack. Now the next cause is where there's a problem with the muscle itself is diseased or has a problem, a common cause. So we call that cardiomyopathy. So a viral infection can cause a cardiomyopathy. Often it gets better over a few weeks or months, but sometimes the heart never recovers from a viral infection. It can be congenital. In other words, a person can be born with a valve problem. It can be degenerative. As you get older, the valve's not working properly. There's conditions like mitral regurgitation or aortic stenosis. The aortic valve calcifies, so the blood can't get out the heart properly. And then infection of a heart valve, we call that endocarditis. These are common causes of valve problems. We always look for that. And there are many patients who we know are presenting with early signs of heart failure. If we fix the valve problem, we can completely reverse their problem. Chemotherapy can affect the heart muscle directly. So we're always very careful with certain chemo agents like adriamycin to check the heart muscle function before and during and after they get chemotherapy. And then there's conditions like alcohol, where people don't realize you drink a lot of alcohol excessively, you can damage and poison your heart muscle. We call that alcoholic cardiomyopathy. So that's the idea when you come and see your doctor, even if you are not having symptoms. That's why checkup is so important, because you may not know you've got high blood pressure. You may not know that your arteries are starting to block up, and you may not know that you actually have a degree of heart failure.